Finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Welcome back to BS Free MD. We're your hosts, Doctors May and Tim Hindmarsh, and today we're exploring a fascinating topic, preventing, treating, and reversing heart disease naturally. Our guest is a renowned board-certified cardiologist, an Amazon bestselling author, and a pioneer in the field of natural heart health. With over 2 decades of experience, his approach has transformed the lives of over 1 million people. He's not only a medical expert, but also a devoted family person and a philanthropist committed to improving global health and well-being. And his best-selling book called The Paleo Cardiologist, The Natural Way to Heart Health, has been a guide for many seeking a natural path to heart wellness.
Yeah, Dr. Wolfson's transformation began with his father's health struggles and was further influenced by his wife, a chiropractor with a holistic view of health. This personal and professional evolution led him to question the standard practices of modern cardiology, especially the over-reliance on pharmaceutical interventions. In the podcast, Dr. Wolfson eloquently shares his story detailing how his experiences reshaped his understanding of heart health. Central to Dr. Wolfson's philosophy is the belief in the healing power of nature. He emphasizes the role of nutrition, lifestyle changes, and the avoidance of environmental toxins, and yes, emotional stress. Imagine that.
And I think tattoos, Tim.
Yeah, but we all have our, as all my patients used to say, I get to keep one vice. I know you don't.
Are we counting?
But we still do.
Are we counting your...
Exactly. So his dietary recommendations, particularly the inclusion of seafood, he's big on seafood, underlie his commitment to natural methods of prevention and treatment. This really is a great show. So sit back and enjoy. And remember, this is for information purposes. We are not your doctors.
We're not your cardiologist. Neither is he, but there's some great tidbits of info. There you go.
We're back with another episode of BS Free MD. Today we have cardiologist, Dr. Jack Wolfson, who has had an amazing life, has really helped people, and started out practicing in a gigantic practice in Scottsdale, Arizona. That is a very high-end area in the United States. So there's lots of people willing to pay to make sure that their heart health is okay. And then he kind of changed gears and got into paleo medicine, shall we say. Let's welcome Dr. Wolfson. Welcome to BS Free MD. Thank you for being here. I cannot wait to dig deep into, how you started your career and then moving straight into, what are you doing now and more importantly, what can our listeners do to keep their hearts healthy?
Yeah, most certainly. Thank you guys for having me on. And it's so wonderful to be on with like-minded doctors, professionals, how people like us, and there's thousands of other doctors like us that are awakening to the brainwashing that we all went through our medical training. And it is a wonderful time right now. It is a great time, again, to be a physician, and how exciting it is for all of us to really be able to help people. So again, I appreciate you having me on.
Yeah. So why don't you, if you don't mind starting just by sharing with our listeners your sort of journey towards advocating for natural heart health, from typical mainstream cardiology training to where you are at. How did things shift for you?
Yeah, for sure. It's I would like to say I was born into the medical matrix. My father was a cardiologist. So I would say that in utero, I'm listening to conversations my father's having with his friends and colleagues or whatever. And then, of course, being born and as a young man, that's all I wanted to be, was a cardiologist. My father was my hero, and I wanted to follow exactly in his footsteps. My father was a DO, and he was the first DO at the Cleveland Clinic in 1970. He was the first DO at University of Iowa in 1972, where he did his cardiology training. And I was born 1970 in Cleveland. So as I would kind of follow exactly in his footsteps, and I would become a cardiologist, getting my final certification in 2002, everything was going fantastic for me. I joined the biggest group in the state of Arizona, hospital-based cardiologist, all the success, financial, professional, everything you could ever hope for as a cardiologist, so one would think. And unfortunately for my father at the time, he was sick. He was in his mid-50s. He was diagnosed with depression. Tried him on pharmaceuticals. The pharmaceutical drugs didn't work. His condition kind of morphed into some movement issues that were labeled as Parkinsonism. He was tried on Parkinson's drugs and they didn't work. Ultimately, at the Mayo Clinic, they would diagnose him with something called progressive supranuclear palsy, which is similar to Parkinson's. And Mayo Clinic says, we have no idea why your father has this. There's no treatment for him, and he will be dead within 3 years. And simultaneously and serendipitously, I was introduced to a young woman. She is a doctor of chiropractic, and she told me exactly why my father is sick and dying. And she told me it's about the food, it's about the lifestyle, it's about the toxins. So here's this 29-year-old chiropractor. She's got all the reasons why my father is sick and dying. Mayo Clinic has none of the reasons. And ultimately, she tells me, if you want to avoid this from becoming you and actually help all the people you contact with and all the patients that you have, you're going to change your lifestyle. And as I would say from the stage, when I hear, I listen, number one, she's smoking hot. Number two, she is, everything she said totally resonated with me. It was my epiphany moment to pull me out of the medical matrix. And yes, we would shortly thereafter get married. We would then after have 4 beautiful children and create a wonderful life, and a life really based on truth and wellness. And, really trying to help people from the medical cartel, the pharma cartel, all these things that, we do talk about. So anyways, that was my moment. So eventually I would leave the biggest cardiology group in the state of Arizona, open up my company, Natural Heart Doctor, worldwide leader in cardiovascular health. And then fast forward, here I am talking to wonderful people like you. So happy to be here.
How many years did you work in traditional allopathic medicine?
Yeah, I was in that big group for 10 years, so I met Heather in kind of like the end of 2004, beginning of 2005. And it took me some time, obviously. I mean, it's like, you can learn, that there is a better reality. But it takes you time, of course, to learn about it. So I tried to read all the books, attend all the conferences, speak to all the doctors that I could speak with, and really kind of up my game and knowledge in order to eventually break free. But I will tell you, listen, when you're, a young physician and you've got bills to pay, you've got, concerns about what other people think, other doctors think, your governing agencies think, insurance companies think, how do we start a practice? How do we do all this? So it took me about, 6-7 years to eventually make that jump. I think really that speaks to why more doctors do not jump from mainstream like you guys have and I have and others have. But why so many don't is that it's so comfortable, it's so secure in the mainstream model. That's number two. Number one, who's willing to let go of everything they've ever been trained, all the brainwashing? It's very powerful. It's all done for a reason for over 100 years, how the brainwashing of the medical doctors is achieved. So to break free from that, to open up your mindset to a better reality, it's not easy, but eventually I was able to do it. And it's cliche, right? Wish we had done it, years before, but, we're all on our path. I believe in our creator, destined, us to do certain great things on the time frame we're able to do so. But, so now I've been a Natural Heart Doctor for over 11 years. And it's been incredible. And I think what makes us, super powerful, of course, I'm talking about all three of us here, is that we've seen the other side. We were born into the other side. We were made into the other side. And now we understand the reality. And of course, choose to practice on this side, which is the right one. And by the way, it's all, everything that I do and talk about, it's all evidence-based. It's all from the literature, because if I were to get called up in front of my medical board and they were to say, what makes you a holistic cardiologist? Where do you come up with this? Where do you come up with some of these therapies? I would say, well, listen, I've done 96 hours of continuing education in metabolic cardiology under Dr. Mark Houston from Vanderbilt University in a group called the American Academy of Anti-Aging. I've done thousands of hours of research, and I wrote a book and participated in the creation of the textbook of integrative cardiology. So, again, there's a lot of, validity to what we do, evidence-based. My book has over 300 references. So it's just unfortunate that most mainstream doctors are not looking to these really root cause, fundamental things in medicine.
Oh, we're finding just through doing this podcast and networking with people that we're starting to find, like we found the first endocrinologist that was going against the grain and saying, no, excuse me, we can get people to reverse their diabetes, get them off all these medications, free from taking all this pharmaceutical crap, and changing diet and lifestyle. And that at that moment, I was like, whoa, this is pushing against the mainstream, like an actual endocrinologist that's pushing back. Like we just never heard of that. And so now people like yourself and more specialists are starting to do this. And people are, I think, excuse me, not, I wouldn't say coming out of the woodwork, but you're right. People's eyes are starting to open. I think what happened in the last 3 years is really changing people's minds. But even, if they had an inkling of that before, people are not afraid anymore to sort of speak out and go against the mainstream. How much pushback did you get initially from your colleagues in cardiology or even the academy doing that? Because you're right. That's the one thing that I think that really, we're at that point in our careers and our age where we're like, we don't give a flip anymore. We're going to speak the truth because we have nothing to lose. But early on, you're right. It's the financial stability. You don't want to go against the grain. You're afraid. So what was your experience really like in the cardiology world?
It wasn't that bad per se, but I was with a group there was, maybe 25 cardiologists and, vascular surgeons, cardiothoracic surgeons, the nurse practitioners. So people would listen to what I had to say whenever they had to. The head of the group actually, because I was very, vociferous, vocal about what I do. And what my belief systems were. And really, when you're sitting at the nurse's station and you're talking about natural immunity without chemical injections into children, it gets a lot of attention, both positive and negative, more so positive, really. But the few complainers that would go back to the head of the cardiology group that I was with, he was a medical doctor, very, very smart guy and a brilliant marketer and businessman. And he said, listen, Jack, I believe in what you're doing. The woman who's about to be my third wife, she's all natural. She loves it. She loves this stuff. I understand what you're saying. But here's the problem. It's bad for business. So you got to stand down. The other doctors don't want to hear this. The referring doctors don't want to hear you talking about paleo nutrition, getting people off of pharmaceuticals, talking about lifestyle, recommending people to chiropractic care. They don't want to be a part of that. So you need to stand down. And when he said that to me kind of enough times, as I was getting reprimanded over and over and over because I wasn't listening to him, I said, I quit. I said, I'm going to move on. And he was nice about it. He was like, hey, listen, we'll be happy to keep your partner money and give it to a non-partner to do the same work. And wish you the best. I don't think you'll be successful, because he felt the world was against, the message, but he was incorrect in that area. But, back to what you said about the endocrinologist real quick. Let me use this opportunity, to say that the diabetes drugs, the blood pressure drugs, the cholesterol drugs, other drugs, they move numbers They move numbers, and that is without denial. They move numbers. But the question is, did they have any meaningful impact?
Yes.
Did they reduce the chances of heart attack, stroke, dying, cancer, you name it? And the answer is no. And what the real problem here is that people have a false sense of security. Well, my numbers are normal on blood pressure drugs, cholesterol drugs, or diabetes drugs, or weight loss drugs. So now I'm normal, but you're not normal compared to the actual normal person without pharma. And that literature is very, very, very clear. But these people are given this false sense of security, and it is a catastrophic problem. One thing too, let me circle back on this real quick, as long as it's on my head, because you talk about governing bodies and what the, what my fellow DOs thought. Like DOs, they're supposed to be holistic. Like this is what, what was taught, to us all through our osteopathic training. And I went to osteopathic school, not because I loved osteopathic medicine. My father was a DO. All of his friends were DOs. He went to osteopathic school because he had a cousin who was at the Iowa school. He went out to visit his cousin. He's like, love this great, campus. I want to hang out with my cousin and his friends. So the DOs, though, are just like the MDs, except for I think sometimes even worse in a lot of these scenarios, because they are so concerned with acceptance and being equal to the MDs that they even go even further in that sense of like straight medical. So I have been reprimanded or attempted to be reprimanded by the DO board on a few different occasions. And, listen, it's all part of going against the grain, doing what's right. And we'll keep the fight going. It's okay.
It's interesting because when you said about do these drugs do anything, which is really fascinating, because there was a study that came out. I can't remember when it was. It's got to be close to 10 years ago. And it basically looked at, diabetics. And it's like, if you treat a type 2, I think it was type 2 diabetes. If you treat somebody, do they live longer? And the answer was no, they don't. Now, there was some evidence that, you get your blood sugar down, you have a delay before you end up on dialysis. You may end up with, forestalling some neuropathy. So the complications of high blood sugar are reduced, which is significant. But it was kind of like once you had the diagnosis of diabetes, you're basically screwed as far as lifespan, according to this retrospective analysis. And I was just like, well, then why are we killing ourselves? And why am I being, graded and paid based on what A1Cs are? You get into the metric mill that's going on in primary care now, and where it's government and insurance company directed that I have to do certain things and ask certain questions. And coincidentally, it all has to do with more pills. So every single person that comes in that hasn't been seen for 6 months gets a depression survey. Why? Because I'm going to sit there and hold their hand and actually counsel them and maybe send them to a pastor and actually figure out their problems. No. So I'm going to give them freaking Prozac and tell them to hit the road. Like that's what it is. And it's a funnel. Like we've made this. And so people get into primary care now and they leave. They can't stand it. It's awful. And I mean, I don't know if you know anything about these metrics, but it is pharma cartels times a million. I mean, it's like putting the drug rep in your house.
Well, listen, let me ask you guys. You guys are family practice trained, originally, and it's just, if someone, were to say to you, why, May and Tim, why aren't you guys talking to your patients about nutrition, about lifestyle? About really making a difference in their blood sugar numbers, their blood pressure numbers, their lipid numbers. What would have been your answer?
I don't have time.
Yeah.
You get paid to see somebody for 5 or 10 minutes. The fastest way to make them go away is to give them a pill and not really deal with the problem. I mean, that would be the standard answer, 15, 20 years ago.
Yeah. I think that, in that scenario, right, it's A, the doctors don't have time. B, we would say the patients don't want to listen to this. They don't want to get any counseling. They don't want anything on that. And then, of course, the third thing is that, Jack, May, and Dr. Tim, we've had no training in this. Right. So it's like when my doctor doesn't give me a lot of time. They don't need a lot of time because they don't know anything except for how to prescribe a pharmaceutical or recommend a test or a surgery. They don't have a clue. They wouldn't, my doctor doesn't spend time to talk to me about nutrition because she doesn't have any idea about nutrition because the brainwashing never included that. From day one, it was always about pharma and surgical procedures.
Pretty much. I always throw in the caveat that where we went to school, we actually were blessed with a little bit, maybe more than what I'm hearing from our U.S. Colleagues. But having said that, the exact same is true. Is like there's the time crunch. We would sit down with patients, and I would remember talking to them about their exercise and how to put their shoes on even every morning just to go out the door and all this plan. And they kind of nod their head and they're like, yeah, but it's too hard. And isn't there a pill for that? I just want the easy way out. And B, the nutritional information we got was totally like stupid and biased because you try to buddy up with your local nutritionist and send these diabetics in, and it's like, well, let's just load them up with they need carbs like continuously. And I'm like, it was crazy. So even that was like fraught with misinformation.
So in 2005, I turned 40 years old, and I did this Act Alive decathlon. I did 10 action sports, skydiving and windsurfing and barefoot water skiing, a bunch of stupid crap, and raised a bunch of money for our diabetic education because it's like, you got to be active. That was the thing. It's like, be active. You don't have to be doing action sports, just be active. So then I was involved fairly significantly with the counselors, which are, the nurse educators and the dietitians. And I'd get in these fights with them because, they get a patient. The patient goes in, they counsel, you send a patient in, please start this patient on insulin so that they get all the diet counseling. Well, what's the diet counseling? Well, carbohydrate exchanges. So you're focusing on carbohydrates, and then you're injecting them literally with fat growth hormone, right? So insulin is like fat growth hormone. It turns carbohydrates into fat. And I'm sitting there, I'm like, what in the wide world of sports are you guys doing? These guys they're type 2 diabetics. Their metabolism is entirely jacked. They don't need any carbs. Well, that's your primary source of energy. I said, that's exactly the problem. But you have to switch that, and then they won't be insulin resistant. And I mean, I went to urgent care, and I said, I'll just deal with people with broken ribs and stuff because this.
Well, how about this? You'd walk into a room and the person was, had a history of diabetes and all the other medical problems that they have, and they're having for breakfast, they're having a stack of pancakes with sugar-free syrup. Like that was one of my favorite ones that I would see. So what I would do when I had the opportunity to write for a patient's diet or something like that, or I would change the diet orders. And this is, back in the day when you can write this directly into a chart as opposed to, everything is of course EMR, electronic medical records, entry and stuff like that. But I would write in there, here's the diet: free-range grass-fed meats, wild seafood, gluten-free, and all organic produce. And then like 20 minutes later, I would get a call from the kitchen area or whoever's in charge of that. And they're like, come on, Dr. Wolfson, we don't offer that, stuff. And it was just like making fun of these people, right? The hospital is the most sick, disgusting place to be in the entire world. Any opportunity, not that anybody would choose to be in the hospital, but wow, how critical it is to really stay healthy, to make sure we avoid that place. That's for sure.
But you got to get your Jell-O, your mandatory Jell-O when you're on your tray. Yeah. But to that point, so can you talk a little bit about sort of your approach to heart disease prevention and treatment, and what you recommend now with your patient coming to see you that say had one heart attack, maybe a stent, and they're like, okay, I want to get off my meds, I want to live the healthiest life possible, or I got this family history of cardiac disease. Instead of just saying, okay, here's your numbers, let's check your cholesterol and look at your blood pressure and, here's some pills for you, go out the door. Take us through what you would do with a new patient coming in with the risk factors or previous disease model.
Yeah, take a person I saw, pretty recently, and the guy is 55 years old. He suffered a heart attack. He's got stents. He's on multiple pharmaceuticals. His heart function is reduced to his ejection fraction, as it's called, as you guys know. It's under 35%. And he had a cardiac defibrillator implanted, or an implantable shock box, similar to a pacemaker. So if his heart stops, he gets resuscitated. And what I told him, I said, just so you know, with your history, the defibrillator device, the pharmaceuticals, your life expectancy as it stands here, right now, your over-under is about 5 years. So if you want to stay in mainstream medical care and live on average until you're 60, then go ahead and stay in that. But if you want something better, if you want the 100-year heart, if you want your best chance of longevity, you're not going to do that. And I believe the answer is to work with us or similar. And our methodology we follow is eat well, live well, think well. And we could talk about those and break those down. And they're all equally as important. Although everybody loves to debate the eat well story, right? Should I go vegan, vegetarian, paleo, keto, carnivore? What should I do? And one thing that I tell everybody whenever possible is, listen, we can debate this all day long. I got my opinions and I believe that they're right. But one thing for sure, no matter what diet you follow, make it organic food. Get the chemicals out of your diet at every opportunity and never let your guard down. No more cheat days, no more, well, I'm on vacation or I eat healthy when I'm at home. We got to get rid of that mentality. But eat well, live well, think well, and then test, don't guess. Not the crappy 1970s testing that most medical doctors are still doing, but we're talking about 2024 state-of-the-art tests that give us incredible in-depth information. So test, don't guess, and then we use evidence-based supplements and biohacking strategies. There is a time and a place for pharmaceuticals and surgeries, no doubt, but it should be at the end of the game, not the beginning. And listen, bless the men and women who work in emergency rooms and trauma centers. We definitely need them. But as the three of us are talking about right now, when it comes to chronic disease prevention, treatment, reversal, the medical community has nothing at all.
I don't think we should do it. I honestly don't think we should do it because we suck at it. Like I totally agree with what Dana White said. He got Gary Brecka's stuff, vitamins and diet and whatnot. And, he looks great. It took 10 or 20 years off of his face, with red light therapy and all of these things. And, who knows exactly what's working, but whatever is going on is working great. And he said, look, if I got in a car accident, I'd absolutely go to a hospital, but I would never go to a doctor for any other kind of health maintenance. And I've said this forever. People are like, well, it's a disease. It's sick care. It's not healthcare. And I'm like, because it's supposed to be. We're doctors. We treat disease. I don't want to go to the integrative trauma surgeon. I want to go to the guy that can, fix my pneumothorax when I fall off my motorcycle. And so I think the new model is we should have tons of paramedical people that are trained, that are maybe overseen by some clinicians and other scientists that does health maintenance, because putting health maintenance in the hands of physicians who are supposed to diagnose and treat disease is how we got in this mess in the first place. Because we came up with antibiotics. We can treat disease with pills. Yes, you can if it's pneumonia. And then we thought we could treat every freaking disease with pills. And then pharma gets involved and says, now what we'll do is we'll treat disease with pills, but you'll never get off the pills. So now we need to make more diseases where you never have to get off the pill. That is a completely broken model. We should stick to what we know how to do, which is trauma, acute injury, acute illness, and start giving all the health maintenance stuff away to other people. Because keep that away from doctors. Doctors should not do healthcare. We should do sick care. And people
But,
say,
but as you know, I mean, there are hundreds of thousands of medical doctors, certainly around the world, millions, and the pharmaceutical industry. I mean, how many employees does Pfizer have? For the first time ever, the pharma revenue is over 1.5 trillion. Pfizer is 100 billion of that on an annual basis. It's just that what we're up against is so monumental. And then, of course, what do we do with all those people? Are they all going to get out of work? Are they all going to retrain? I think the three of us would love to see that. At Natural Heart Doctor, I've got another cardiologist. We've got naturopathic doctors, chiropractors, and a team of health coaches. And to your point, I mean, the health coaches are absolutely brilliant, in that kind of, what would be said to be, chronic disease, I guess management, only in that sense. They view everything through that lens of eat well, live well, think well, test, don't guess, evidence-based supplements, biohacking strategies. But the foundation is the eat well, live well, think well. I think we can't take someone who eats McDonald's cookies and cupcakes and say, oh, well, you get red light therapy, you should sauna, here's some IVs. We definitely don't want to encourage that. And that's something that I never do. It's kind of like when a man comes to see me and he's got low testosterone. Like, okay, there's sometimes we need to, urgently prescribe testosterone to get him, motivated and to do some of these other things, because there are some extremes. But in general, the whole idea is, why is someone's testosterone low? Why is someone's thyroid numbers out of whack? Why are their blood sugar abnormalities there? Why are their lipids abnormal? Why are they inflamed? And the whys are always the violations of eat well, live well, think well. And by fixing those, that's going to be the key. And yeah, we can rely on biohacking strategies, but do I think that everybody needs to lay in a $100,000 red light bed? Yeah, probably not. There's definitely some foundational things that we need to do, but
I want to kind of segue into a little bit of the eat well, live well, think well. I love it. As far as the eat well, I mean, anything to add to that. We did, like last year, the year before, we went down the diet train with everybody from reversing disease with a vegetarian rheumatologist to the whole paleo and carnivore thing with Anthony Chafee. We just had Sean Ryan on. We've talked to
Sean Baker.
Sorry, Sean Baker, not Sean Ryan.
I'll have Sean Ryan on.
Faux pas. But we've gone down from the complete animal diet and carnivore and lion diet to the reverse and in between. Anything to, that's our opinion, is what you said, is really taking the crap out of your diet, not eating processed food, and finding real food, whole food. And that's probably the biggest impact, really, when you balance out why these seem to be working in people's disease processes is just eating the real food as best as you can. You have anything else to sort of add to what you like to do?
Yeah, I mean, of course, I love to talk about it. So I'd love to add, to the conversation of some of these people. And, let me say this. No society in the history of the world has ever been vegan. No animal is vegan. They either eat other animals or they eat insects. Every society in the history of the world has been hunter-gatherer. Therefore, none have ever been strictly carnivore. So lions and tigers, and I mean, again, typically a carnivore, an obligate carnivore, is defined as 70% or greater of meat products. So, wolves, I mean, they're eating berries. I mean, they're eating stuff out in the wild. They may be eating the innards of the animal that contains, those plants as well. So it is only the vegan the carnivore who's doing that. I think the other mistake carnivores make is that they don't get the seafood. So here's what I say. The number one most important food in the entire world is seafood. That's number one. Number two, nose to tail, free range animals, preferably bison, including the organs, and try and find a bison company to get the, liver, heart, kidney, whatever other organs you can get, the muscle meats. And typically bison have very little, vaccines, and preferably trying to find an unvaccinated bison. Which I think would be an ultimate.
I just have.
I need a sign. Stand on the street corner like the mattress person.
I'm envisioning, a Cherokee warrior, running after a bison with a gigantic, needle
Syringe.
trying to
There's
vaccinate
a meme for
it.
you.
So I'm
Oh
like,
my gosh.
Yeah. It's just common sense approach that the explorers wrote about. The anthropologists, paleontologists who document eating this particular way and living this particular way, for that matter. And so what we follow again is that, we're going to do we're seafood, nose to tail, healthy animals. I'm always, in particular, I'm gluten-free, so I never eat anything that contains gluten. I may have some rice and may have some beans once in a while. I'm not 100% strict on the hunter-gatherer. I do have some variation from that. When it comes to, of course, I'm always organic. Like this T-shirt. This is an organic cotton T-shirt from Wear Packed Clothing. We take the lifestyle very seriously. And then also, when it comes to sugar intake, I just want to be realistic. And if everybody could say, okay, I'm not going to have any kind of processed sugar, whether it's white sugar, brown sugar, coconut sugar, it doesn't matter. And the only sweetener that you would use would be raw honey. And that is ancestral and that was available. So we do raw honey and we eat fruit. So that's, the diet plan that I follow that I think it's pretty easy to maintain. And that's my approach. I love the idea of intermittent fasting. Our ancestors fasted, of course, drinking super clean water, sometimes with minerals added to it. But, I think carnivore is okay for a cleanse or a challenge. Don't forget the seafood. I think that even if you wanted to go some kind of gluten-free vegan or a raw vegan approach, I think, again, you could do that for a short term, but I don't think it's sustainable. People with the highest levels of omega-3 from seafood have the lowest risk of everything: heart attack, stroke, cancer, atrial fibrillation, deep venous thrombosis. And they also have the lowest risk of COVID. So we really need to embrace those omega-3s, not from a fish oil capsule, but from the food.
Okay, so of course everybody's going to be wanting to ask about the seafood because of all the, it's all most of the stuff you get now in the grocery store, especially, is kind of crap, or it's farm raised, and avoiding, there's the toxins and the mercury and the whatever. So, any recommendations on best place to look for seafood or what type to eat mostly?
Yeah, we push people to do wild salmon, sardines, anchovies, clams, oysters, shrimp, lobster, crab. Salmon roe is another total delicacy. We actually encapsulated freeze-dried salmon roe. We had it third-party tested. There's no mercury and there's no microplastics. Same thing with our sardines. There were no microplastics in our encapsulated nose-to-tail sardine product. So I don't think that the fish, really represents a problem. The American College of Obstetrics and Gynecology, they told pregnant women for years not to eat seafood, and then they reversed it because it was leading to low IQ babies for all the reasons that we've mentioned, because the importance of the omega-3s. So that was a major, major mistake. As I sit here right now, is the ocean contaminated? Yeah, the whole planet's contaminated. I mean, is that a surprise to anyone? Polar bears have hundreds of chemicals. Newborn babies have hundreds of chemicals. Organic cabbage from California will have contaminants in there. So the whole world, fatalistically and unfortunately, is destroyed. But as far as those, if I was I'm not going to eat shark or swordfish or Chilean sea bass or some of the big tunas. But I got to tell you, I'm much more concerned about not getting omega-3s from seafood than I am mercury. Mercury, these metals, I think that they're a problem, but not to the level that most holistic medical doctors would push that they are. I don't think that they're a problem. I mean, they're natural. Mercury, lead, arsenic, cadmium. These are things that are found in nature. I think there's a lot more pollutants and contaminants, pesticides, phthalates, parabens, BPA, that are worrisome. And then also, before we started talking, we talked about some of the issues with mold and bacterial toxins from water-damaged buildings. That, I believe, is much more deleterious to our health than getting mercury from tuna.
Interesting. So, so as someone that's allergic to shellfish, as I am, it makes it a little bit more difficult because you can't do the crab and shrimp, lobster. But as far as, eating salmon, etc., that's not a problem. So it kind of limits things a little bit. Even with the fish oil supplements, I've heard that some of them can be cross-contaminated with shellfish particles. And so I think it was Dr. James DeNicolantonio, who do you know him at all? I follow him a lot on Instagram. He's got some great recommendations, but suggesting as far as supplementing using krill oil because it can be better. Do you have any thoughts on that? No?
Yeah, I mean, again, everybody's got their agenda. Everybody's trying to make money, these days. And he's obviously a bright man. He's published, some good things. But as far as krill oil is really dangerous and destructive to the environment to farm krill. I mean, that's the bottom of the food chain.
Right.
So we want to be really careful about how we mine krill. I used to use krill initially, and I didn't find that it moved the needle on raising omega-3 levels. But ultimately, listen, our ancestors didn't eat krill. We're not whales. We eat seafood, and we should eat that seafood. That's the cleanest, best source. If people have allergies to it, I would say, well, again, is there a shellfish? I mean, and there's different levels of allergies. Of course, there's some people who break out in hives or a rash or a runny nose. Whatever it may be. And there's some people, again, that would have true anaphylaxis. So if you have true anaphylaxis, can you work with some kind of holistic allergist or even a non-holistic allergist to try and figure out strategies, solutions so you can eat the seafood? Again, try and find the seafoods that you can eat, but you got to get something in. But no, I would disagree with that, doctor that krill would be a solution. Fish oils is not the solution. That's all there is to it. As much as let's just say it's a processed food, and why not eat the seafood, which ultimately should be the strategy. Find the seafood. What we are concerned about certainly is that there is some positive data regarding omega-3 fish oil supplementation, but there also have been a couple recent studies that showed that people who consume fish oil have an increased risk of atrial fibrillation, which is not something we want. And I think ultimately that we are incorporating just synthetic oils into our cell membrane and to the membranes of our organelles inside of that. And, we kind of, I guess if you would ask a typical medical student, what's the brains of the cell? Just like you would ask a layperson, they would say, well, it's the nucleus. Well, the nucleus, contains the genetic material to create new cells and to make proteins for those purposes. But the brains of the cell is the cell membrane. That's the fence that allows things to get inside the cell that belong, keeps things outside of the cell that don't belong, how cells communicate with each other. I mean, it's such a phenomenal area. And essentially that the cell membrane is loaded with two things. Number one is cholesterol, which is why cholesterol is so important. And the other is omega-3 fish oil. So
eat your fish oil. Don't take it as a capsule, basically.
So
eat your fish that contains the oil. Correct.
Okay. You want to talk about lipids?
Well, I do, because my head explodes almost every time I go to work. I work in urgent care, super busy. So I get to do two things. I get to talk to people about their colds and tell them that they don't need a Z-Pack. And then the next thing I do is I get to review their chart at least a little bit. And, you see these people come in, they're like a 50-year-old woman is on maximum doses of a statin plus Zetia. Well, and then you haven't had a heart attack. There's zero evidence for, especially all-cause mortality evidence in women. I mean, there's really none in men, but there's even less in women. And now you're on an agent, Zetia, which decreases your luminal absorption of cholesterol from your gut. And I'm like, how in the hell did that ever get approved by the FDA? I can kind of understand tweaking the liver and maybe changing how the liver metabolizes fats. That at least intuitively kind of makes sense. But now you're eating less cholesterol when cholesterol is an absolutely essential thing that you need, because let's face it, what's your brain? It's a giant sack of cholesterol inside a helmet, basically. And I'm like, and now we have agents that essentially alter your diet, when if you really wanted to alter your diet, just alter your diet.
Yeah, it's I mean, and again, like the statin industry, Lipitor is the number one selling pharmaceutical revenue wise of all time. Number one of all time is Lipitor, now, generic atorvastatin. And it's just so many people have been killed by this philosophy. Now you would say, well, what do you mean? How have they been killed? The literature doesn't say that, because again, it gives people the false sense of security. What the literature tells us in the most recent 2022 review, which was in the Journal of the American Medical Association, which we all know is one of the biggest medical journals in the world. What they found there in March of 2022 was that for primary prevention, meta-analysis, statin drugs lower your risk of heart attack, stroke, and dying by a little teeny bit for primary prevention, a little bit better for secondary prevention, meaning people who've already had a heart attack, a stroke, stents or bypass surgery. So for primary prevention, again, overall, all comers, it's a very little benefit. And it's not about how do we reduce the risk of having a heart attack in the next year from 2% to 1.8%. It's about how do we reduce it to 0%. Because if we only reduce it to 1.8%, we've failed the 1.8% people that still had the heart attack or similar data still died, and we've failed them. And that's what the data shows. Now, of course, the pharmaceutical industry is a marketing industry, and they market to the medical doctors and market to the public. And they say, they talk about these dramatic reductions. And of course, it's all done in what's called relative risk. Oh. But as far as absolute risk reduction, it is absolutely tiny. And that's on their data. Now, we could go totally conspiratorial and say their data is purely made up.
Right.
It's purely made up because it is a $1 trillion industry. And I think ultimately you'd have to at least open your mind to the possibility that is not what it is. And then real quick, again, if you look at trials like Sparkle was a trial done in 2006, New England Journal of Medicine. And Sparkle looked at people who had a stroke or a TIA. They were randomized to 80 milligrams of atorvastatin versus placebo. And they followed them over time. And what they found over time is that the group on atorvastatin, which was Lipitor, they had less strokes and they had less heart attacks by a small amount. I mean, a couple of percentage points, over the years. But here's the problem. More people died in the statin group. Now, it wasn't statistically significant, but more people died. And don't tell me again that the pharmaceuticals are saving lives. The medical doctors profess this all the time, when again the literature doesn't support that. All Hat LLC was a primary prevention trial done on people 65 and older. More people died in the statin group. In fact, if you were 75 and older for primary prevention, 34% more people died, and that was statistically significant. So AFCAPS, TexCaps was the original statin trial done on lovastatin back in the 1980s, and they found more people died in the statin group. So, ultimately, it's just not a good approach. But again, it's what most people push, and they vilify. The marketing behind this is just, it's incredible.
No, it's incredible. I saw a guy at work who was 99 years old and will very, very shortly turn 100, and he was still on a statin.
Yeah, it's just
I'm
total BS. Like, what the heck?
I mean, it's not thinking. It's not treating a patient. It's treating a number. It's right.
Exactly.
You're at a gun range, and the target pops up, and you just shoot it. Yeah. My head blows up.
I have to ask two things. Loaded question here, of course. So when it comes to biohacking and etc., I read Peter Attia's book. He's huge on using statins. So just thoughts on that. But number two is,
well, you think you should start statins when you were like 21 years old?
Yeah,
completely insane.
And number two, I guess next is for our listeners that are basically like, okay, what do I do about my lipids, my cholesterol? What do you measure in 2024 with all the data we have? What are you looking at when someone comes in? Would you measure their full panel, and what do you care about, and let them know what numbers? What is it? LDL, VLDL? Which are the numbers that really matter?
Yeah, real quick. I'm not familiar with Peter Attia's book. People have asked me about Peter Attia and some of his philosophies. It's just, To me, it's all about doing what is right by Mother Nature. We can't improve on that at this time as it pertains to, chronic disease management. We are built perfectly, evolutionary, in the image of God, however you want to believe that we got here. Why would we think that we need a statin drug at the age of 21? There's just no reason why that would be the case. And if we tell that 21-year-old, hey, here's what we have to do: eat well, live well, think well, that's going to be the ultimate strategy. So listen, if you're someone who thinks, okay, well, I'm going to be this biohacker, including pharmaceuticals, and I'm going to take these drugs because Peter Attia says so, okay, that's fine. Go ahead. I would totally disagree with that and other people. I've not prescribed a statin drug in over 10 years, and I'm never going to. Another real quick thing is that people often talk about PCSK9 inhibitors, Repatha, and others, and I'm against the use of those pharmaceuticals as well. The data there was interesting. That study came out in 2018, New England Journal of Medicine. We're talking about some sick people that were in that study, 15,000 people in each group. It was a massive trial. And what they found is that despite the fact that with a combination of, because most people were on statin drugs and either they got the Repatha or placebo, what they found is that LDLs went down to 32. And there was a heart attack benefit. There was a slight stroke benefit. But unfortunately, more people died in the Repatha group. Wasn't statistically significant, but nonetheless, 18 more people died. And I assure you it was significant to them. It's not the answer. I mean, it's not the answer. It's not the approach, for anyone. And I don't prescribe that. And then Zetia. And the joke about Zetia is that Zetia was approved just on the soft endpoint of LDL reduction.
Yes.
They had no hard endpoints for years. And then eventually, after years and years and years, Merck publishes a study that shows that Zetia in combination with simvastatin, which was their other drug, Zocor, that combination together was better than simvastatin alone, again, by a little teeny tiny bit. And ultimately, listen, you guys have done studies. I've done studies. I've been involved in these things. You check one box, you check another box. They can all be fudged. They can all be played with. I mean, look at all the things that go on around this world. There are many, many, many evil people in this world that do not care about you as an individual and do not put it above someone who is running a $50 million pharmaceutical company to fudge the data. Real quick, to answer your question, when we see abnormal lipids, when we see abnormal LDLs or HDLs, and the HDLs are dysfunctional, or the LDLs are small and dense, or they're oxidized, the answer is not what pharmaceutical should we use, or frankly, what supplement should we use. The answer is to figure out why. Why is the body failing in this? And I'll say it again. It's a violation of eat well, live well, think well. If we change up the nutrition, change up the lifestyle, get rid of all these different toxins. The liver is what is making lipids and clearing lipids. And by the way, no one on planet Earth produces too much LDL, and no one produces too much cholesterol. The problem is that these particles are not cleared because of an unhealthy liver. And if we fix the liver to improve hepatic clearance, there's 1 out of 250 people have a genetic defect in ApoB as a lipoprotein or in their LDL receptor. But most commonly what happens is that all these toxins in our environment, they gum up the LDL receptors. They interfere with the conversation between the ApoB lipoprotein on an LDL particle and that receptor. Like say, for example, there's maybe it's too much mercury, lead, arsenic, maybe it's mold mycotoxins, other environmental toxins that are interfering with the ability of that LDL to dock. These are the problems, and this conversation has nothing to do with statin drugs or any other pharmaceutical. But ultimately, I guess to your point, to me, if I had one marker to measure on people, it is going to be a marker of inflammation or oxidative stress. I don't even care anymore what people's lipid numbers are. If they have inflammation and or oxidative stress, they're in trouble. and we have to figure out why. If their inflammation oxidative stress numbers are normal, then certainly all of our methods are still warranted, but it shows that they are in a good place and they are on track.
So I can't get away from I'm assuming the live well side of this is, exercise, sunlight, sleep, all that stuff.
And say the other S word. I'm surprised.
Sex, clearly.
That's part of it. I guess when you say exercise, I like to say like sexercise, because a lot of times these all start with S, right?
Yes.
Seafood, sunlight, sleep, sexercise.
There you go.
So, but the one I really want to get into is the think well, because we've completely ignored this. And May and I have had some massive changes in our life in the last 4 years. I mean, not just COVID, changing jobs and fighting with ex-employers and,
health issues,
parents passing away, and May had
family
2 big
issues,
surgeries, and we moved across the country, blah, blah, blah. Okay. And, you almost get immune to this idea that you're just sort of in fight or flight all the time. And you sit there and you go, that's got to be really unhealthy. So let's talk a little bit about that.
Yeah. And, I take, and I'm sure you guys are interested in this as well, when you're working in urgent care, although of course most medical doctors are not, what happened just before your heart attack? What happened just before your stroke? What happened just before your Takotsubo cardiomyopathy, which literally is broken heart syndrome? Like, what was the stressful event that led to that? Spontaneous coronary artery dissection, number 1 cause of heart attacks in women under 50. So, there's nothing we could do about that stressful event that led to this, per se. But again, like in order to prevent the next one, people need that insight. And that's where Think Well comes in, just as important as the Eat Well and the Live Well. So inside the Think Well, yes, it's spirituality. It's the, sense of community that we all need, as opposed to social isolation. It's purpose, it's passion, it's gratitude. It's security. Do we feel safe in our home, in our job space, in our workspace, all these kind of things. But as we also look into things like childhood emotional trauma and childhood trauma, massive correlation with other risk factors accounted for. That just a traumatic event, and there's so many different ways to go about that. And certainly that's not my area of expertise, right? I could talk about nutrition, I could talk about lifestyle, I could talk about mold, toxins, and stuff like that. I'm trying to up my game as much as possible in the Think Well area, but also affiliate myself with people that do have the best Think Well strategies for people, but really to get the eyes opened up that it is a tremendous factor. If you are not happy versus a happy person, happy people live longer, they live better. So you need to find your happy, and you need to find it very, very quickly, because this chronic stress thing is bad. Acute stress, we're used to. Chronic stress, we're not. And it's deadly. It is deadly.
No, that is awesome. So
I was going to ask him, we talked about the lipids, but being the cardiologist, the hypertension, high blood pressure is another really obviously big focus on prevention, because same thing, if you're stressed, your blood pressure is going up, you're not doing all the modalities such as sleeping well, exercising. Can you talk a little bit about hypertension, and do you, as a cardiologist, do you try to focus obviously away now from using blood pressure medications? Is there any time when you say, yeah, it's necessary because, we got to bring your blood pressure numbers down quickly to avoid like a catastrophic stroke or event until we can reverse and work on the rest of these lifestyle modifications? Do you sort of adhere to the standard recommendations for blood pressure numbers? Do you have a favorite or class of medications that's different? I mean, anything different? Let's talk about blood pressure. What are your thoughts on that?
Yeah, no, that's a great question. And, 47% of adults are labeled with hypertension. And of course, the answer to that is the pharmaceuticals, of which it is a, hundreds of billions of dollar industry. And it's just built on a foundation of lies and inaccuracies. So if blood pressure is high, it's a sign that there's a problem. It's not really a problem. It's a sign that there's a problem. When you tell the medical doctors that it is a problem in and of itself, and then the only answer, of course, is pharmaceuticals, now you're in the situation where people are in. Now they're on pharmaceuticals, suffering all the side effects. The pharmaceuticals may or may not bring the numbers down. 2019 study showed actually that if you look at cardiovascular events, they kind of broke it down into 4 different curves. But let me say this. Of course, the people with the best health and wellness were the people with normal blood pressure, not on drug, right? I mean, they're healthy people. I mean, in general, so normal blood pressure, not taking drug. The highest risk of cardiovascular events were the people with normal blood pressure on blood pressure drugs. Meaning it was actually a higher risk if your blood pressure was normal on blood pressure drugs than if your blood pressure was still high.
Wow.
While you're on blood pressure drugs, or if your blood pressure was high, not on drugs. Very, very interesting. And I've shown this to other cardiologists, and they're just jaw dropped.
Wow.
Jaw drop. And that's why I say that just because your blood sugar or your lipids or your blood pressure numbers are normal on pharma, you're in trouble. You're in real trouble, and you better figure it out. So maybe to your point, I mean, if someone comes in my office, their blood pressure is 220 over 110, I'm going to start them on a pharmaceutical with the idea we're going to get you off of this as quickly as possible. I do think, though, that the dangers of acute blood pressure elevation are incredibly overblown. Like every doctor, even myself, like I still struggle with some of the brainwashing that I went through. Oh my God, their blood pressure is 210 over 120. They're going to have a stroke at any minute now. That's not the case. A lot of these people, they've been running around with high blood pressure, 200 over 110, and they've been doing so for years. And they have I'm not saying it's a good thing, but what I'm saying is ultimately is that we have to find the natural strategies to normalize blood pressure. But yet mainstream, they're going to this other direction, even in the sense of how barbaric this is. They are cutting the renal nervous innervation, the nervous system innervation to the kidneys in an attempt to lower blood pressure. Like, this is absolute barbaric medicine in 2024, and they're calling this state-of-the-art therapy. And it's just, people are suffering. We've got to figure out why. The reasons why: violations of eat well, live well, think well. Tim, you mentioned that the importance of sun. Hey, listen, cholesterol is coursing through the blood vessels of our skin. It's coursing through the capillaries inside an LDL particle through our skin. And when the sunlight hits it, specifically the wavelength of the UVB part of the spectrum, UVB turns cholesterol into vitamin D. Vitamin D goes up, cholesterol goes down. Abnormal cholesterol oftentimes is a sunshine deficiency syndrome. Our ancestors ran around outside naked. Most people rarely even see the sun, even in Florida where you guys are at.
No, absolutely true.
It's true. I tell patients that all the time. I said, I know we live in Florida, but your vitamin D probably still sucks, because how we're designed to get vitamin D is sun comes up, you crawl out of the cave, you run around chasing a mastodon for 12 hours, sun goes down, you go to bed. After you dragged your wife into the cave by her hair, obviously.
Oh, yeah, right.
So,
man, have you listened to Jack Cruz on Huberman's podcast to talk about sunlight therapy? I mean, man, talk about going deep into the weeds on
quantum biology.
That's an amazing podcast. Like, even for myself, I'm like, I have to listen to it 3 times just to catch up with his thoughts.
Yeah, I would consider Jack a friend of mine. I know Jack pretty well since 2016. We both spoke together and spent some time together at an event in Vermont, which was wonderful. And Jack is absolutely brilliant about the things that he is brilliant about. He tends to diminish the food part of the story, which I think is a major mistake. The fact that I did listen to the majority of the Huberman podcast, and the fact that Jack can kind of talk over Huberman for 2+ hours, I think was impressive, because obviously Andrew Huberman is a very intelligent person, although obviously he's got mistakes, as well, as far as his theories and his thinking, in my opinion. But Jack Kruse is obviously a big light guy, but it's like you can dive down the rabbit hole with Jack as deep as you want to go, to a quantum level, and you can again just be blown away and mesmerized by the things he's saying. Most of us don't have time to sit there and listen to Jack Kruse, talk about 4 hours, or pay for his website. But just like you said, Tim, our ancestors were outside all day, chasing after a mastodon, building shelter, getting water. All plants and all animals are outside in the natural light their entire lives. It is only the human that is stuck inside, and we're all running around worried about skin cancer, and we're worried about melanoma and all this other fear. It's almost like the powers that be want us to be sick. And it's because they do, because that's how they make their money. The military wants us to support military endeavors. The oil, and gas industry want us to support the use of their stuff. Everybody's got, something that they're trying to make money from. But our ancestors spent all their, what happens, to your blood pressure when you're outside? The sun, through UVA, hits stored nitrate in the skin and releases it as nitric oxide. Nitric oxide is a vasodilator. What's a sunburn, right? You're in the sun for too long, your skin's all red, you press on it, it gets white, and then you release, and then it gets, again, the blood flow comes in. That's all nitric oxide, dilating open those blood vessels. But we don't need the research, although the research is obviously extensive in there. It's just common sense stuff. And the medical doctors, it's not even like they lost the common sense. They never had the common sense. It was, just from, day one, part of the brainwashing.
Yeah, well, it really is amazing. I really believe that all the critical thinking gets pounded out of you in medical school, and because you best not ask a question of the authority. Like it's I don't know what it's like now. I mean, we've had some residents, and it's pretty scary how fragile they seem to be, but that may just be a generational thing. But it was, you learn this is how you do things, and you only do it this way, because if you don't, you're going to kill people. And then you take that out, and you get a generation of doctors that just do what they're told. And then it gets completely ridiculous. I mean, I told this story on an episode that released today, but I was sitting in the airport a year or two ago, and, it's middle of COVID, and I met this lady who was an OBGYN, and, somebody asked me about the COVID vaccine. I said, well, no, I would recommend against that, blah, blah, blah. And I was explaining this, and this woman, here's the conversation. She's like, every single disease that doesn't exist anymore doesn't exist because we vaccinated it away. And I'm like, what about sanitation? Like, what about the fact that there's no cholera, but we don't vaccinate cholera? I mean, it was just, what in the world are you thinking?
Yeah. And even still, it's a matter of the fact that not many children have chicken pox. Is that a success? Is the fact that there's not measles, whatever chicken pox is, but that they're not circulating around, is that a success? There's data from the journal Atherosclerosis, 2016. Men with a history of measles and mumps have a 29% lower heart attack risk over a certain amount of time frame. So, these were beneficial things that happened to us over time, and they actually have benefit to it. But, to get into the whole vaccine thing, the fact that they're giving hepatitis B vaccine to newborn babies, that should automatically throw out the entire industry. If they're willing to inject newborn babies with massive amounts of aluminum, to allegedly protect them against Hep B. Like these people are willing to do anything, and then they do anything by COVID and what that is. And listen, hopefully more and more people are waking up. I think what's going to happen is that the next time around, they'll get even more draconian. They'll get more into even worse fear and scare tactics, and it'll just lead to total anarchy and chaos, and who knows where it'll go. But listen, trust in our God-given abilities to stay healthy. Give the body what it needs. Take away what it doesn't. That's the strategy. Let me tell you. Real quick about mold mycotoxins.
Absolutely.
Because you guys mentioned, penicillin, by the way, right? Penicillin is a mold mycotoxin. It is a toxin released from the penicillium mold that happened to kill the bacteria growing in Alexander Fleming's lab. He wakes up, one day, he comes into his lab and he sees that his bacteria cultures are dying because they're contaminated by a mold. So the mold's over here, the bacteria colony is dying over here. So there's something in between that's doing it. And eventually that would be distilled out as what would be known as penicillin from the penicillium mold. Now, there's another pharmaceutical that you guys are probably familiar with. It's called Cellcept. Cellcept, Cellcept. It is a pharmaceutical given to suppress the immune system in people with autoimmune disease, lupus, Wegener's, Hirschsprung's, all these different names that we learned, years ago, which is another topic of how meaningless all that stuff is. And then it's also given to organ transplant recipients. You get a new heart, new kidney, new liver. Cellcept is one of those things you take in order to suppress your immune system. So Cellcept is one thing in there. And that is something called mycophenolic acid. What is mycophenolic acid? It is a mold mycotoxin that you can test yourself for. And therefore, if you are elevated in mycophenolic acid, which comes from a water-damaged building and or contaminated food, you are on an immunosuppressant. If you are living in this environment and therefore essentially taking in this pharmaceutical that suppresses the immune system, what does that mean if you're on a chronic immunosuppressant? Well, look at the side effect profile of the chronic immunosuppressants. Look at the side effect profile of Cellcept, right? Infections, cancer, all these different diseases because you've suppressed the immune system because you live in a water-damaged, mold and or bacterial contaminated building. So, because we talk about all these different toxins, by the way, too, which is interesting, right? We talk about lead, arsenic, mercury, cadmium. We talk about EMF. We talk about asbestos. We talk about BPA, phthalates and parabens. Literally a million different chemicals that are out there, some natural and some not. But mold is a living, breathing organism, and so is bacteria. It's been here since before we were here. It's going to be here long after we are here. It knows how to survive. So it releases the Army, Navy, Air Force, Marines, these mycotoxins in order to kill off other molds, bacteria, insects, and potentially humans. So this living entity is undoubtedly the most dangerous. Now you could say, are there particular poisons, whatever, if someone has whatever kind of poison that one may invent that could acutely kill someone. Yeah, I guess that there are chemicals, that are made in that arena. And a lot of those came from plants as well. But nonetheless, this problem of this chronic immunosuppressant, I've got a blog post, 14 different mechanisms of mycotoxin cardiovascular toxicity. As it relates to LDL receptors, coagulation, gut microbiome, intestinal hyperpermeability, autonomic dysfunction, autophagy. I mean, you name it, it's all right there. My point is that if you are sick, please get tested yourself personally with a urine mycotoxin test, and also test your home. I don't care if your home is brand new, but also, listen, guys, I was talking to someone a couple of years ago, and she actually bought a bed and breakfast I think it was outside of Sarasota, to be honest with you. She was just suffering from all these health problems. And I'm like, maybe it's, where you're living. How old is, where you're living? And she's like, oh, well, I bought this bed and breakfast. It's a historic landmark. It was built in 1910. And I said, how many hurricanes do you think your home from 1910 has been through? Can you imagine the amount of mold? Oh, what do we do? How do we remediate that? You don't remediate that. You move out of that.
Yeah.
And somebody else takes it over, or you burn the whole thing to the ground. You can't fix that. But again, my point is that if you are sick, from whatever it may be, please make sure that you're living in a safe home. It's critically important.
No, that's a really valid point, and we haven't gone really deep into that. We did a podcast interview with Alex Stewart from Australia, who's a host of Low Tox Life. She's written a book, and she really talks about a lot about that. I mean, in Australia, lots of mold, damp, and environment as well, but the importance of testing and considering that in the body's health, and a lot of the conditions from autoimmune and just in general, like you said,
brain, cancer, heart disease. And real quick, let me say this, May, too, is that it doesn't matter if you live in a human environment, although obviously it's more common in a human environment. But I've got patients, right, and they live in Colorado, they live in Arizona, they live in the deserts of Utah or California, and they're like, well, it's dry here. And I say, well, do you have any running water? Do you have a sink, a shower, a toilet? Do you have a dishwasher? Do you have a laundry machine? Oh, yeah, of course I do. Well, then you better check for mold. Because unless you're living in a tent in the forest, which could also have mold, there as well. But,
especially a tent.
It's like Ronald Reagan used to say, trust but verify. I trust you, I believe you, but I really want to help you, and I don't want to miss this. Because this is a big one. We got to test, don't guess.
Are there any tests? I mean, so if someone goes out to check for a mold, is there any specific or tests that are better than others, or just any mold test will do? Just verify whoever's doing the testing. Any recommendations on that?
Yeah, we actually, so we use the urine mycotoxin test. So you can test for, urine mycotoxins in the comfort of your own home. And that's we use Vibrant America for that. Okay. Vibrant Wellness. They're the best company in the world. We sell that on our website. The other thing we sell on our website is called the number 8 Swiffer test. Again, it's a do it at your own home, because what happens is you hire an inspection company and they come in and they don't do the the Swiffer test, and they set up plates. Well, a plate is only good if there's mold circulating in the air at that moment that are landing on the plate. The environmental toxin test, the test, is just a better test to be able to collect dust samples from around your home, run it. And in addition to that, you're also checking for water damage bacteria. I'm not saying the answers are easy, and I'm not saying they're cheap. That's for sure. But I'm saying that they're answers to the vast majority of chronic health problems.
No, that's a really good point. So basically the answer is run, and just, you're pretty much, burn it to the ground or leave.
Yeah, well, and we talked about this, before we got online, is that, we purchased some decent sized property down in Costa Rica. And one thing we're going to do down there is create a like-minded community, but it's also going to be a mold-free community. We've, talked to architectural firms and designers and builders about how do you create a mold-free home? To the best of your ability, even in the mountains of Costa Rica. So you construct things out of concrete, glass, and steel. You keep all the pipes open and exposed. So if there is a leak, if there is a problem, you're easily able to identify it. You don't have things where mold can grow easily, on obviously wood and particle board and drywall and things like that. So you try and mitigate those risks as much as possible. And then again, if there is a problem, it is a finite thing that you can remediate. But there's so many people walking. You remember how, you're a kid and you walk into someone's house or into grandma's house and there was that musty smell. What do you think the must smell is from?
Yeah.
It's from VOCs released from the destruction of building materials by mold and or bacteria. And how much did they talk about this in medical school, right?
Oh.
Zero.
Exactly.
That's wild.
No.
Well, we could go on forever. This
Now
has
that everyone
been
wants to
great.
come see you or move with you to Costa Rica
How
and have you take care of them,
can
how do they do that?
I mean, yes, I gave some shameless plugs in there for my mold testing and for the environmental testing and the Costa Rica project.
Yeah.
So I would just say, listen, if you like the stuff that I had to say today, let's be friends, follow us on social media, go to my website, join our newsletter. The website is naturalheartdoctor.com. Of course, I put this information out there all the time. And then what we're going to do is we're going to do a webinar actually about the Costa Rica project and say, listen, if you're interested, this is what the opportunity is. We'll give you some thoughts around that. And then from there, it'll probably go to, more like one-on-one phone calls to see, again, if it's all like the right fit, for this project. But again, I appreciate, being on with you guys and being with Friendly Fire. And it's, we live in such a crazy world. And again, the social isolation thing is such a problem, and I guess I would say this too, is that, it's all about, moving forward in our relationships and finding the happiness in these relationships, and bless the old relationships. They listen, hey, Tim, you remember in medical school, we did this and we did that. Yeah. We went here, we went there. Yeah. You know what? There's all these great memories of what we did, but we don't really see eye to eye anymore. So thank you for those wonderful memories. And I hope you have a fantastic life. And next time I see you, we'll talk about, what we did in medical school and residency and fellowship. But moving forward, I'm going to hang out with like-minded people who really understand what's going on in this world.
We couldn't agree more. I mean, we drove 3,500 miles to try to do that to at least a certain degree. Not like we don't and still do have amazing friends where we laughed, but
don't drive to Costa Rica. My uncle did that.
Yes.
He drove from Costa Rica to Canada when he went back. And
he bought a car in Toronto and drove it to Costa Rica.
Yeah. Anyway.
Yes. Well, I mean, let me say this. I mean, the area that we found down there is incredibly safe. Some of the pathways to get there, but I think a lot of that too, I think ultimately is, if we do get concerned about traveling here or there, that's just buying more into the fear agenda. So they're trying to fear us from travel, trying to fear us from, just keep us in fear. And when we're constantly in fear, then we're constantly going to take their pharmaceuticals. We can't sleep. We need to take a sleeping drug. We can't sleep. They tell us about commercials, about all of our different health problems. We're under fear. Let me tell you guys one more story. There was a guy that I saw a couple of years ago. And I'm like, hey, your blood pressure's sky high today. What's going on? He's like, oh, I haven't slept well the last couple of nights. I'm like, why not? He's like, why not? Haven't you been watching the news? Didn't you see about these church bombings in Sri Lanka? And I'm like, no. I'm like, let me get on, I'll go on to Google and I'll see, what? I'm like, oh, this is horrible. There's multiple, church bombings, and the Islamists, they're bombing these churches in Sri Lanka. This is horrible. Hundreds of people have died. This is a total catastrophe. But you, sir, who is a very wealthy person in North Scottsdale, Arizona, what are you going to do about it? You're going to move to, are you going to go travel to Sri Lanka and go help the Sri Lankans? You're going to go send money to Sri Lanka? I hope you do both of those things. God bless you if you do, but you're probably not going to. So the only thing that happened was you watched the news all night. You didn't sleep at all. Your blood pressure's sky high, and you're going to, be in trouble because of this. So again, they love to sell us the fear. We got to unplug from the fear, trust our abilities, trust Mother Nature, trust, our immune system to get the job done. And that's my policy. I'm sticking to it.
Perfect. What a great way to tie this together. Thank you again so much, Dr. Jack Wolfson. We got to do this again because we've just barely scratched the surface.
Yeah.
Thank you, guys. I appreciate it.
Well, today's episode was more than just a show. It was a clarion call for a fundamental shift in the way we view and treat heart health by highlighting the limitations of conventional medicine and advocating for a natural, holistic approach. I did love the fact, though, that he still uses pharmaceuticals. I I get super weirded
it's not
out.
all or nothing.
Yeah, I get super weirded out when people get into these all or nothing tribes. Then it just becomes a religion, and it's not science and evidence based and all of these things that we've come to know and enjoy. And it goes both ways. So I appreciated that, and I would never want people to go, yeah, I'm just going to go and stop all my pills. Well, you can potentially get off your medications, but you need somebody to guide you to do that. So
medications are a tiny tool, not a cure.
Ah, yes. Tiny tools. I know all about it. So, anyways, I really enjoyed that.
Check him out. Check out his book, his social media, and see if he's, I don't know, your
cup of kombucha.
There you go.
Yes. Outstanding.
Oh, all right. And today's shout out goes to Mrs. Deborah Self from Instagram. I wonder how long you've been following us. Anyway, we love that you are interacting with us on our social media. Please continue doing so. And we love it. It fills up our need for positive reinforcement.
Yes.
We appreciate you and hope you stick around. And we will see you all next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
Well, we try to keep BS Free MD as raw and real as possible. We can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.